All right, I'm going to get started on my persuasive speech on ADHD and if you think medication is appropriate and what you should do first, or if you think that you should try other things before you try the medication. So ADHD is a mental condition. It causes children and adults to have a hard time to focus, hard time to pay attention, hard time to sit still, hard time to move. They're just always, it's a running motor. It can cause problems in school, but it can also cause problems in your everyday life, even at work as an adult. Although it is nothing dangerous, it should be treated. Treatment can include therapy or pills, but are pills too dangerous? Some people may say yes, some people may say no. Even though ADHD medication helps children pay attention, most people think that it should be given as a last resort, if anything at all. So let's dive into what medications do to someone's body, how they affect your brain, and what kind of medications there are available. There are some side effects. You got to think about the effects on your body. Your behavior may change, and eating issues. There are many different medications for people with ADHD, from chewable medications to patches to pills. Most pills have serious side effects, but some are always ignored. I think anybody that gets a pill bottle kind of sometimes ignores that side effect. So there are really serious side effects when you are taking medication for ADHD. That could be decreased appetite. That is people not wanting to eat. Medication is a suppressant, so it does suppress your appetite. So a lot of people, when you are on the medication, you do have to go in every month for a weight check at your doctor's office. They also have some irritability that comes with medication for ADHD. So some children and adults are already irritable, and then they take this ADHD medication, and it causes them to be more irritable. Would that be okay? Would you take irritability over focusing on a task? So that's a big side effect that people ignore, but you got to think, do you want to be irritable or do you want to focus? And it's sad that you have to choose, but sometimes you have to choose. The ADHD medication also has an issue with making someone not be able to sleep and become someone who has a sleep disorder. This medication typically causes your sleep to become more affected in a negative way. You get moodiness, hypertension's a big one, and then stomach pain. So along with not being able to eat because it's suppressing your appetite, sometimes you get the stomach pain, the headaches, the everything. So that's just some side effects that you need to worry about when it comes to taking a medication for ADHD. We're going to also talk about how it affects your brain. What does it do to your brain? What are the positives and the negatives for your brain chemistry? I know a lot of people get that negative thing when they think that ADHD medication causes something wrong in your brain. That is actually not accurate. How do these medications affect your brain, you may ask? Like most medications, you need to know this going forward. You need to know this so that you know what is affecting your organs in your brain. ADHD medications primarily are stimulants. They work by increasing the level of key brain chemicals like dopamine and norepinephrine, which are crucial attention and focus parts of your brain. This essentially helps your brain communicate more effectively between your neurons, leading to improved concentration and reduced hyperactivity in people with ADHD. The effect is achieved by modulating the neurotransmitters, allowing them to stay active longer in synapses. This improves your communication, your attention, and it also helps with your focus and attention. This is not a magic fix. While ADHD medication can significantly improve your symptoms of these things, it does not cure an underlying brain dysfunction, which is what ADHD is. Everyone wants to say ADHD is a behavior disorder, but it is not. It is actually a underlying brain dysfunction. So sometimes you might need those medications alongside other things to be able to cope with this issue. So medications, there's children medications that are just specifically for children. There are pills, there are patches, and there is liquid form. There are many forms of ADHD medication. This depends on many things like your insurance, your age. Can you take pills? Can you not take pills? What else you may be taking for other problems in your life. And the most common medications you will see is like Adderall, Detrorex, Ritalin, Focalin, Methylene, etc. These are very common medications, and they are given to children without reading those side effects. And I know there's a study right now where Adderall is causing children to hallucinate. So you're seeing things, you're hearing things. Is that worth your child being able to focus in school? You tell me. There is medication that is chewable. It's called Quilichew. It is for children. It comes in 20, 30, 40, 50 milligrams. And it is really, really hard to get your insurance to cover that. So a lot of people do go to Adderall and Ritalin for their children with the more serious side effects, because insurance will not cover the less side effect version until you try the more side effects. So there's a Daytrana. It's a prescription of central nervous system in the brain. It's a stimulant medication used for ADHD in children and adolescents 6 to 17 years old. It may also help increase attention and it increases attention but decreases impulsivity and hyperactivity in children with ADHD. It is not known that it is safe or effective in children under 6 of age, so you have to have that child 6 or older to take that medication. So this is more for your older children and adults. These do not have much research to back up, so it's denied by most insurance companies. That is a big thing. So, is the pill safe? Why are they highly discouraged by everyone? And why does insurance not want to accept that as the first step? With medication, you have a lot of people who will tell you what they know and what's best for you and your child, even if they do not know you and your child. It is your duty to make sure that you do not let their encouragement deter you from what you think is right for your child, or your doctor thinks is right for your child. You and your doctor know what's best moving forward, however you wish to do. The hardest thing is getting the medication approved by your insurance. I know that is the hardest thing. Insurance is really hard to get a hold of, and even if you get a hold of them, usually they won't approve your ADHD medication unless they see that you have tried to do the therapy, do the school therapy, do all this stuff before they'll approve the medication. Also, people like to give you spill out of the mouth false information about the medication. The medication is not dangerous. The side effects may be a little dangerous, but that is with every medication. So, so if you think that ADHD medication is right for you and your child, use it. I would, but that is just my opinion. Have a good day.